Mental Health Awareness, a Comprehensive Guide. 1. Introduction. 1.1 Definition of Mental Health. Mental health refers to the state of our emotional, psychological, and social well-being. It impacts how we think, feel, and act in our daily lives. Mental health is essential at every stage of life, from childhood and adolescence through adulthood. It influences our ability to handle stress, relate to others, and make choices. When we speak of mental health, we are not only referring to the absence of mental illness but also the presence of positive characteristics such as emotional resilience, self-esteem, and the ability to enjoy life. Mental health encompasses a wide range of conditions that affect mood, thinking, and behavior. These include common disorders like depression and anxiety, as well as more severe conditions such as schizophrenia and bipolar disorder. Mental health is dynamic, changing throughout a person's life, and is influenced by various factors including genetics, environment, and lifestyle. 1.2 Importance of mental health awareness. Mental health awareness is crucial for several reasons. First, it helps individuals recognize the signs and symptoms of mental health disorders, which can lead to early intervention and treatment. Early intervention is often critical in improving outcomes for those suffering from mental illness. Awareness also plays a significant role in reducing stigma associated with mental health conditions. Stigma often prevents individuals from seeking help, leading to a worsening of their condition. In addition to individual benefits, mental health awareness contributes to a healthier society. By promoting understanding and compassion, we can create a supportive environment where people feel comfortable discussing their mental health issues without fear of judgment or discrimination. Awareness also drives policy change, leading to better access to mental health care and resources. This, in turn, improves overall public health and reduces the economic burden associated with untreated mental illness. 1.3 Overview of mental health statistics. Mental health issues are widespread, affecting millions of people worldwide. According to the World Health Organization, WHO, 1 in 4 people will be affected by a mental or neurological disorder at some point in their lives. Currently, around 450 million people are suffering from such conditions, placing mental health disorders among the leading causes of ill health and disability globally. Depression is the leading cause of disability worldwide and is a major contributor to the overall global burden of disease. Approximately 264 million people suffer from depression. Anxiety disorders, another common mental health condition, affect about 284 million people. Suicide, which is often linked to mental health conditions, is the second leading cause of death among individuals aged 15 to 29 years. These statistics highlight the critical need for mental health awareness and intervention. Despite the high prevalence of mental health disorders, many people do not receive the care they need due to stigma, lack of awareness, and insufficient mental health services. 2. Understanding mental health. 2.1 Mental health versus mental illness. Mental health and mental illness are related but distinct concepts. Mental health refers to our overall psychological well-being, encompassing our emotions, thoughts, and behaviors. It is about how we feel about ourselves, how we relate to others, and how we cope with life's challenges. Good mental health is characterized by the ability to manage stress, work productively, and contribute to the community. Mental illness, on the other hand, refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior. Mental illnesses can vary in severity, from mild conditions like anxiety and depression to more severe disorders like schizophrenia or bipolar disorder. While mental health exists on a spectrum, mental illness typically requires clinical diagnosis and treatment. It is important to note that everyone has mental health, just as everyone has physical health. However, not everyone will experience a mental illness. Mental health can fluctuate due to life events, stress, and other factors, and good mental health is something that everyone can strive for, even if they have a mental illness. 2.2 Common mental health disorders. Understanding common mental health disorders is essential for raising awareness and promoting early intervention. Here are some of the most prevalent mental health conditions. Depression. Depression is a common mental disorder characterized by persistent sadness and a lack of interest or pleasure in previously rewarding or enjoyable activities. It is often accompanied by other symptoms such as fatigue, changes in appetite, difficulty concentrating, feelings of guilt or low self-worth, and suicidal thoughts. Depression can be long-lasting or recurrent, significantly impairing an individual's ability to function at work or school and cope with daily life. Anxiety disorders. Anxiety disorders are the most common mental health disorders in the world. They encompass a range of conditions, including generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias. Anxiety disorders are characterized by excessive fear or worry, which can interfere with daily activities. Physical symptoms may include a racing heart, sweating, trembling, dizziness, and shortness of breath. Anxiety disorders can lead to avoidance behaviors, where the person avoids situations that trigger their anxiety, which can impact their personal and professional life. Bipolar disorder. Bipolar disorder is a mental health condition marked by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. During a manic episode, individuals may feel euphoric, full of energy, or unusually irritable. In contrast, depressive episodes may lead to feelings of sadness, hopelessness, and a lack of interest in most activities. The mood swings can affect sleep, energy, behavior, judgment, and the ability to think clearly. Treatment typically involves medication and psychotherapy. Schizophrenia. Schizophrenia is a severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, which can be distressing for them and for those around them. The symptoms of schizophrenia include delusions, hallucinations, disorganized thinking, and extreme agitation or immobility. Schizophrenia typically requires lifelong treatment, including antipsychotic medications and supportive therapies. Post-traumatic stress disorder. 2.2 Common mental health disorders. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a mental health condition triggered by experiencing or witnessing a terrifying event. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. People with PTSD may feel stressed or frightened even when they are not in danger. This disorder can lead to significant impairments in personal and professional life. PTSD is often associated with military veterans but can affect anyone who has gone through a traumatic experience, such as a natural disaster, serious accident, terrorist act, rape, or other violent personal assault. Treatment options include therapy, medication, and support groups. Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder, OCD, is characterized by unwanted and intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, that a person feels compelled to perform. Common obsessions include fears of contamination, a need for order, and aggressive or taboo thoughts. Compulsions are repetitive behaviors like hand-washing, ordering, checking, or mental acts such as praying, counting, or repeating words silently. OCD can interfere with daily activities and cause significant distress. Cognitive behavioral therapy, CBT, and medications are often effective in managing OCD symptoms. Eating disorders. Eating disorders are serious conditions related to persistent eating behaviors that negatively impact health, emotions, and the ability to function in important areas of life. The most common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Individuals with eating disorders may experience extreme concern about weight, body shape, and food, leading to dangerous behaviors such as extreme dieting, binge eating, and purging. These disorders can cause severe physical health issues, including heart conditions, digestive problems, and even death. Treatment usually involves a combination of therapy, nutritional counseling, and medical supervision. Borderline personality disorder, BPD. Borderline personality disorder, BPD, is a mental health disorder characterized by unstable moods, behavior, and relationships. People with BPD may experience intense episodes of anger, depression, and anxiety that last from a few hours to days. They may also struggle with feelings of emptiness, fear of abandonment, and a distorted self-image. Relationships can be intense and chaotic, with rapid shifts in emotions. Individuals with BPD may engage in impulsive behaviors, such as substance abuse, risky sexual behavior, or self-harm. Treatment often involves psychotherapy, such as dialectical behavior therapy, DBT, and medication to manage symptoms. Attention deficit/hyperactivity disorder, ADHD. Attention deficit/hyperactivity disorder, ADHD, is a neurodevelopmental disorder that affects both children and adults. ADHD is characterized by symptoms of inattention, hyperactivity, and impulsivity that are inappropriate for a person's developmental level. Individuals with ADHD may have trouble focusing on tasks, following instructions, or organizing activities. They may also be overly active and have difficulty remaining still or quiet. ADHD can lead to challenges in academic, occupational, and social settings. Treatment typically includes behavioral therapy, medications, and lifestyle changes to help manage symptoms. 2.3 Causes and Risk Factors. Understanding the causes and risk factors of mental health disorders is essential for prevention and early intervention. Mental health disorders are complex, and their development is influenced by a combination of genetic, biological, environmental, and psychological factors. Biological factors. Genetics. Mental health disorders often run in families, suggesting a genetic component. Individuals with a family history of mental illness are at a higher risk of developing similar conditions. However, genetics alone do not determine mental health outcomes. They interact with environmental factors to increase susceptibility. Brain chemistry and structure. Imbalances in neurotransmitters, the brain chemicals that transmit signals between nerve cells, can contribute to mental health disorders. For example, low levels of serotonin are associated with depression. Additionally, structural abnormalities in the brain, such as differences in the size or activity of certain regions, can also be linked to mental illness. Hormonal imbalances. Hormonal changes, such as those occurring during puberty, pregnancy, or menopause, can influence mental health. Conditions like depression and anxiety are often linked to hormonal fluctuations, especially in women. Environmental factors. Trauma and abuse. Experiencing trauma, especially during childhood, significantly increases the risk of developing mental health disorders. This includes physical, emotional, or sexual abuse, as well as neglect, witnessing violence, or losing a loved one. Trauma can have long-lasting effects on the brain and behavior, leading to conditions such as PTSD, depression, and anxiety. Substance abuse, including alcohol and drug use, is both a cause and a consequence of mental health disorders. Substance abuse can alter brain chemistry and exacerbate existing mental health conditions. Conversely, individuals with mental health disorders may use substances as a way to cope with their symptoms, leading to a vicious cycle of worsening mental health and addiction. Chronic stress. Prolonged exposure to stress can contribute to the development of mental health disorders. Stressful life events, such as financial difficulties, relationship problems, or job loss, can trigger or worsen mental health issues. Chronic stress affects the body's ability to regulate emotions and can lead to disorders such as anxiety, depression, and PTSD. Psychological factors. Personality traits. Certain personality traits, such as high levels of neuroticism, a tendency to experience negative emotions, or low resilience, the ability to bounce back from adversity, can increase the risk of developing mental health disorders. Individuals who are more sensitive to stress or have difficulty managing emotions may be more prone to anxiety and depression. Cognitive patterns. Negative thinking patterns, such as catastrophizing, expecting the worst, or rumination, repeatedly focusing on distressing thoughts, can contribute to mental health disorders. Cognitive behavioral therapy, CBT, is often used to help individuals identify and change these maladaptive thought patterns. Early childhood experiences. Early attachment relationships with caregivers play a critical role in shaping mental health. Secure attachments provide a foundation for healthy emotional development, while insecure or disrupted attachments can increase the risk of mental health disorders later in life. 3. The stigma surrounding mental health. 3.1 Historical perspective on mental health stigma. the stigma associated with mental health has deep historical roots. In many cultures, mental illness was once thought to be caused by supernatural forces, such as possession by evil spirits or divine punishment. Individuals with mental illness were often ostracized, subjected to inhumane treatments, or confined to asylums where they lived in deplorable conditions. These early misconceptions and mistreatment of those with mental illness have left a lasting impact on societal attitudes toward mental health. During the 18th and 19th centuries, the medical community began to recognize mental illness as a medical condition rather than a moral failing. However, treatments were still rudimentary, and people with mental illness continued to be marginalized. The rise of psychoanalysis in the early 20th century brought some progress in understanding mental health, but stigma persisted. Even as psychiatric care improved, the portrayal of mental illness in popular culture and media often reinforced negative stereotypes, further entrenching stigma. 3.2 Cultural influences on mental health stigma. Cultural beliefs and norms play a significant role in shaping attitudes toward mental health. In many societies, mental illness is still viewed as a sign of weakness or a personal failing, leading to shame and discrimination. This stigma can be particularly pronounced in collectivist cultures, where social harmony and reputation are highly valued. In such contexts, individuals may be reluctant to seek help for fear of bringing dishonor to their family or community. Religious and spiritual beliefs can also influence perceptions of mental illness. In some cultures, mental illness is believed to be the result of spiritual imbalance or punishment for moral transgressions. These beliefs can lead to the exclusion of individuals with mental health disorders and the reliance on spiritual healing practices instead of medical treatment. In contrast, some cultures have a more accepting attitude toward mental health. For example, indigenous communities often view mental health as a holistic concept, encompassing emotional, physical, and spiritual well-being. This perspective can promote a more supportive approach to mental health, although access to mental health services may still be limited. 3.3 Impact of stigma on individuals. Stigma has far-reaching effects on individuals with mental health disorders. One of the most significant consequences is the reluctance to seek help. Many people with mental health conditions avoid treatment because they fear being judged, discriminated against, or labeled as crazy. This delay in seeking care can lead to a worsening of symptoms and a lower quality of life. Stigma also affects how individuals view themselves. Internalized stigma, or self-stigma, occurs when people with mental health conditions adopt negative societal attitudes and apply them to themselves. This can lead to feelings of shame, guilt, and worthlessness, exacerbating the mental health condition. Self-stigma is associated with lower self-esteem, reduced motivation to seek help, and poorer treatment outcomes. Moreover, stigma can lead to social isolation. Individuals with mental health disorders may be excluded from social activities, face discrimination in the workplace, or experience strained relationships with family and friends. This isolation can further compound the challenges of living with a mental health condition, making recovery more difficult. 3.4 Efforts to reduce stigma. Reducing stigma is a critical component of improving mental health outcomes. Efforts to combat stigma take many forms, including public awareness campaigns, education programs, and advocacy efforts. Public awareness campaigns. Public awareness campaigns are designed to educate the general public about mental health and reduce stigma by promoting understanding and empathy. These campaigns often feature personal stories from individuals living with mental health disorders, which can help to humanize the issue and challenge stereotypes. Examples of successful campaigns include the Time to Change campaign in the UK and the Beyond Blue initiative in Australia. Social media has also become a powerful tool for raising awareness and fighting stigma, as it allows individuals to share their experiences and connect with others facing similar challenges. Mental health education. Education is a key strategy for reducing stigma, particularly in schools and workplaces. Mental health education programs teach students and employees about mental health, the signs and symptoms of mental health disorders, and the importance of seeking help. These programs aim to create a more informed and supportive environment where individuals feel comfortable discussing mental health issues. In schools, mental health education can help young people develop resilience and coping skills, reducing the risk of developing mental health disorders later in life. Advocacy and policy change. Advocacy efforts focus on changing laws, policies, and practices that contribute to stigma and discrimination. Mental health advocates work to ensure that individuals with mental health disorders have equal access to healthcare, education, employment, and housing. They also push for the inclusion of mental health in public health agendas and the allocation of resources to mental health services. Advocacy efforts have led to significant policy changes in many countries, including the implementation of anti-discrimination laws and the expansion of mental health coverage in health insurance plans. Peer support programs. Peer support programs involve individuals with lived experience of mental health disorders providing support and guidance to others facing similar challenges. These programs are based on the idea that individuals who have been there can offer unique insights and encouragement. Peer support can help reduce stigma by normalizing mental health issues and showing that recovery is possible. These programs can take place in various settings, including community centers, online platforms, and healthcare facilities. 4. The role of education in mental health awareness. 4.1 Importance of mental health education in schools. Mental health education in schools is crucial for promoting early awareness and intervention. Schools are not only places for academic learning but also environments where children and adolescents develop social skills, form relationships, and build their sense of identity. Integrating mental health education into the curriculum helps students understand the importance of mental well-being and equips them with the knowledge and skills to recognize and address mental health issues in themselves and others. Introducing mental health education at a young age can have long-term benefits. It fosters resilience, emotional intelligence, and coping strategies, which are essential for navigating life's challenges. Early education can also reduce the likelihood of students developing mental health disorders later in life. Additionally, it creates a supportive school culture where students feel safe discussing their mental health concerns and seeking help when needed. Mental health education in schools should cover a range of topics, including the identification of common mental health disorders, the impact of stress and trauma, the importance of self-care, and how to access mental health resources. Schools can also implement programs that promote social and emotional learning, SEL, which teaches students to manage emotions, set goals, show empathy, maintain positive relationships, and make responsible decisions. 4.2 Workplace mental health awareness. Workplace mental health awareness is essential for fostering a supportive and productive work environment. Mental health issues can significantly impact an employee's performance, job satisfaction, and overall well-being. By promoting mental health awareness in the workplace, employers can help reduce the stigma associated with mental health disorders, encourage employees to seek help, and provide the necessary support to manage mental health conditions effectively. Workplace mental health initiatives can include providing mental health training for managers and employees, offering employee assistance programs, EAPs, and promoting a healthy work-life balance. Mental health training can help managers recognize the signs of mental health issues in their team members and provide appropriate support. EAPs offer confidential counseling and resources to employees dealing with mental health challenges. Creating a positive work environment that prioritizes mental health can also reduce absenteeism, improve employee retention, and increase overall productivity. Employers can encourage open communication about mental health by implementing policies that support mental well-being, such as flexible work arrangements, mental health days, and access to mental health resources. By promoting mental health awareness in the workplace, organizations can contribute to the overall well-being of their employees and create a more positive and inclusive workplace culture. 4.3 Public awareness campaigns. Public awareness campaigns are vital for promoting mental health awareness on a broader scale. These campaigns aim to educate the public about mental health issues, reduce stigma, and encourage individuals to seek help when needed. Effective public awareness campaigns often use a combination of media platforms, including television, radio, social media, and print, to reach a wide audience. Successful public awareness campaigns typically feature relatable stories from individuals who have experienced mental health challenges. These stories help humanize mental health issues and break down the barriers of stigma. Campaigns also provide information on how to recognize the signs of mental health disorders, where to find help, and the importance of early intervention. In addition to raising awareness, public campaigns can also drive policy change by increasing public support for mental health initiatives. For example, campaigns may advocate for better access to mental health services, increased funding for mental health research, or the implementation of anti-discrimination laws. One example of a successful public awareness campaign is Mental Health First Aid, which trains individuals to identify, understand, and respond to signs of mental health issues in their community. Another is the Bell Let's Talk campaign in Canada, which has raised millions of dollars for mental health initiatives and sparked a national conversation about mental health. 4.4 Role of social media and digital platforms. Social media and digital platforms play an increasingly important role in mental health awareness. These platforms offer new opportunities for reaching large audiences and fostering open discussions about mental health. Social media allows individuals to share their experiences with mental health, connect with others facing similar challenges, and access mental health resources and support. However, the role of social media in mental health is complex. While it can be a powerful tool for raising awareness and reducing stigma, it can also have negative effects on mental health, particularly among young people. The constant exposure to idealized images and the pressure to maintain a certain online persona can contribute to feelings of inadequacy, anxiety, and depression. To maximize the positive impact of social media on mental health awareness, it is important to promote responsible use of these platforms. This includes encouraging users to engage in positive and supportive interactions, providing accurate and reliable information about mental health, and creating safe online spaces where individuals can discuss mental health issues without fear of judgment. Digital platforms also offer opportunities for innovative mental health interventions. For example, mobile apps can provide mental health support, such as guided meditation, mood tracking, and cognitive behavioral therapy exercises. Online therapy platforms offer access to licensed mental health professionals through video calls, making mental health care more accessible to those who may not have access to traditional in-person therapy. 5. The importance of early intervention. 5.1 Recognizing early signs of mental illness. Early intervention is critical in the management and treatment of mental health disorders. Recognizing the early signs of mental illness can prevent the condition from worsening and improve the chances of recovery. Early signs can vary depending on the specific disorder but often include changes in behavior, mood, or thinking that interfere with daily life. Common early signs of mental illness include persistent feelings of sadness or hopelessness, withdrawal from friends, family, and social activities, extreme mood swings or changes in personality, excessive fear, worry, or anxiety, difficulty concentrating or making decisions, changes in eating or sleeping patterns, unexplained physical ailments such as headaches or stomachaches, substance abuse, thoughts of self-harm or suicide. It is important to note that these signs may be subtle and can easily be mistaken for normal reactions to stress or life changes. However, if these symptoms persist or worsen over time, it may indicate the onset of a mental health disorder. Early recognition and intervention can lead to more effective treatment and better long-term outcomes. 5.2 The role of primary care providers. Primary care providers, PCPs, such as general practitioners, family doctors, and pediatricians, play a crucial role in the early detection and treatment of mental health disorders. They are often the first point of contact for individuals experiencing mental health issues and can provide initial assessments, referrals, and ongoing care. PCPs can screen for mental health disorders during routine checkups by asking questions about mood, behavior, and daily functioning. They can also provide education about mental health and discuss any concerns the patient may have. If a mental health disorder is suspected, the PCP can refer the patient to a mental health specialist, such as a psychiatrist, psychologist, or counselor, for further evaluation and treatment. In addition to diagnosing and treating mental health disorders, PCPs can also provide support for managing chronic mental health conditions. This may include prescribing medication, offering lifestyle recommendations, and coordinating care with other healthcare providers. By integrating mental health care into primary care settings, PCPs can help reduce the stigma associated with mental health disorders and ensure that individuals receive timely and appropriate care. 5.3 Community Resources and Support Systems. Community resources and support systems are essential for promoting early intervention and providing ongoing support for individuals with mental health disorders. These resources can include mental health clinics, crisis hotlines, support groups, and community-based organizations that offer counseling, education, and advocacy services. Support systems, such as family, friends, and peer groups, play a critical role in helping individuals with mental health disorders manage their condition. A strong support system can provide emotional support, practical assistance, and encouragement to seek treatment. It can also help reduce feelings of isolation and improve overall well-being. Community-based mental health services are often more accessible and culturally relevant than traditional mental health care settings. These services can be particularly valuable for individuals who face barriers to accessing care, such as financial constraints, lack of transportation, or cultural stigma. By providing care in familiar and supportive environments, community resources can help individuals receive the care they need early on and throughout their recovery journey. 6. Mental health and the legal system. 6.1 The intersection of mental health and criminal justice. The relationship between mental health and the criminal justice system is complex and multifaceted. Individuals with mental health disorders are disproportionately represented in the criminal justice system, often due to a lack of access to mental health care and social support. This overrepresentation has significant implications for both the individuals involved and the broader society. Many individuals with mental health disorders come into contact with the criminal justice system as a result of behaviors related to their condition. For example, untreated mental illness can lead to behaviors such as substance abuse, homelessness, and petty crime, which can result in arrest and incarceration. Once in the criminal justice system, individuals with mental health disorders often do not receive the treatment they need, leading to a cycle of recidivism and worsening mental health. The criminal justice system is not equipped to address the complex needs of individuals with mental health disorders. Jails and prisons are often ill-prepared to provide adequate mental health care, and incarceration can exacerbate existing mental health conditions. Additionally, the stigma associated with both mental illness and criminal records can create significant barriers to re-entry into society, including difficulties finding employment, housing, and accessing mental health services. 6.2 Mental health courts and diversion programs. Mental health courts and diversion programs are specialized interventions designed to address the needs of individuals with mental health disorders who come into contact with the criminal justice system. These programs aim to divert individuals away from incarceration and into treatment, with the goal of improving mental health outcomes and reducing recidivism. Mental health courts are problem-solving courts that provide an alternative to traditional criminal justice processes for individuals with mental health disorders. Participants in mental health courts are typically required to engage in treatment and comply with court-ordered conditions, such as regular check-ins with a judge, counseling, and medication management. Successful completion of the program may result in reduced charges or dismissal of the case. Diversion programs are another approach to addressing the intersection of mental health and criminal justice. These programs aim to divert individuals with mental health disorders away from the criminal justice system and into community-based treatment. Diversion programs can occur at various points in the criminal justice process, including pre-arrest, pre-trial, or post-conviction. By providing treatment and support instead of incarceration, diversion programs can help individuals with mental health disorders avoid the negative consequences of criminal justice involvement and promote recovery. 6.3 Advocacy for mental health reform in the legal system. Advocacy for mental health reform in the legal system is essential for addressing the overrepresentation of individuals with mental health disorders in the criminal justice system and ensuring that they receive the care and support they need. This advocacy takes many forms, including policy change, legal challenges, and public awareness campaigns. Policy change is a key component of mental health reform in the legal system. Advocates work to promote laws and policies that support diversion programs, improve access to mental health care in jails and prisons, and protect the rights of individuals with mental health disorders. For example, some states have implemented laws that require mental health training for law enforcement officers to help them respond appropriately to individuals in crisis. Legal challenges can also play a role in mental health reform. For example, lawsuits have been filed against jails and prisons for failing to provide adequate mental health care, leading to improvements in the treatment of incarcerated individuals with mental health disorders. Public awareness campaigns are another important tool for promoting mental health reform in the legal system. These campaigns aim to educate the public about the intersection of mental health and criminal justice, reduce stigma, and build support for policy change. By raising awareness and advocating for change, these efforts can help create a more just and equitable legal system for individuals with mental health disorders. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.